Good morning, good evening, good afternoon, wherever you're tuning in from. We're glad you're here. My name is Lindsay Brown from Beyond Clean. It's a beautiful sunny morning here in Minneapolis, Minnesota, and I'd like to thank you for joining us for this collaborative webinar between Beyond Clean and Census Technologies. If you haven't joined us for a Beyond Clean virtual event, I'd like to call your attention to a couple of features on your screen. On the upper right-hand side of your screen, you'll see a list of resources prepared by the speaker today and also the conference sponsor, Census Technologies. These resources will allow you to take this particular conversation a little bit further. There's a question and answer tool on the left-hand bottom side of your screen where you can submit questions for the speaker throughout the presentation. The questions submitted in that Q&A engagement tool will be addressed at the end of the presentation during the question and answer portion. I do also want to call your attention to the group chat feature. Along the bottom of your screen, you'll see a bunch of icons, and one of them is blue with some thought bubbles. That's a group chat feature where you can interact with the speaker throughout the presentation and also interact with other attendees of this event. This has been an exceptional year. We could not have planned or predicted it. We could not have prepared for it. But now we can choose how we react. We can choose to build our resilience muscle, to put in the hours of practice deliberately. Because every time we choose to get up, to delve deeper, to practice harder, to fight for what we believe in, for what we stand for, we grow our resilience. And that is the theme of this month's Census webinar series, is true resilience. We get stronger and more prepared because resilience, just like our other muscles, has muscle memory. We can get better starting today. And with that, I'm so excited for today's presentation about lifelong learning in healthcare. Our speaker, Jim Stebinski, has over 25 years of experience in perioperative nursing, and he's currently the CEO of the Competency and Credentialing Institute and the CCI Research Foundation in Denver, Colorado. Dr. Stebinski maintains an active research agenda centered on nursing demographic and patient outcomes studies. And today, Jim is going to be talking about lifelong learning. There's been a renewed emphasis on skills and competency assessment that has forced the education and training efforts of healthcare professionals to evolve. Regulatory bodies, accreditation agencies, certification boards, all of these stakeholders have been affected by changes and are also influencing important changes. So this presentation will dive into examples from the fields of sterile processing and perioperative nursing to illustrate the practical implications of this evolution in education. So with that, I am honored to welcome our speaker today, Dr. Jim Stebinski.
Thank you, Lindsay. And I'm broadcasting to you, extraordinary times from Denver, Colorado. So it's pretty early here. Here's our title slide. The presentation today, Education is Changing to the Need for Lifelong Learning. And I would like to say thank you to Lindsay and Beyond Clean, but especially to Census and Grace for inviting me. Grace wanted a veteran to present, and we're near Veterans Day, and she asked me to present. I'm honored. I'm very thankful that you chose to get up early and attend this presentation. And these are my credentials. And I don't often put this on my slides, but I'm retired Navy. I actually served 34 years, active Army, and active Army starting in the 70s. And then I went on to the Navy. In my last job, I managed operating rooms for the Navy. So let's get started. And this is what I look like now, current day. I'm the CEO of the Competency and Credentialing Institute, and we do certification for nurses that work in the operating room. And you can also see I'm a college professor. I'm adjunct faculty. I teach graduate students at Nova Southeastern University in Florida, and also doctoral candidates at Wilkes University in Pennsylvania and I teach topics like healthcare policy and healthcare finance, leadership, those sorts of things. So this is my background, and this is about CCI. So we're going to get to this in a moment, but I realize that not all of you are nurses. But that is my background. When we go back to the whole veteran thing, I had the old GI Bill. I'm a Vietnam era veteran. I did not serve in Vietnam. I served in Germany, but I had the old GI Bill, and I used that to attend a diploma of nursing school in Toledo, Ohio. And they paid for almost all of that with the old GI Bill. And then eventually I came to CCI. Used to manage operating rooms, worked in the military, but this is CCI. So we're the largest group in the world that does certification for nurses that work in the operating room. We're a 501c6, we're nonprofit, we're based in Denver. I will also point out that we're not part of the membership organization, AORN. They're a great organization. They're also based in Denver, but we're a separate organization. We're nonprofit, and all we do is work with nurses and help them with their certification, professional development needs. And we support now 41,000 nurses worldwide that hold our credentials. These are all of our credentials. They're on the slide here. Some of them are familiar. Some may not be as familiar because they've just recently been started, like the ambulatory surgery credential. But at the very end of this presentation, we are going to return to the credential you see at the top, CPNF. We're going to speak about that at the very end, and that's a very new concept. The other thing is we have provided a resource for you that's available with the course materials, and it's a white paper about education levels in perioperative nursing. It was written by CCI staff members. That is part of what the value that we bring and what we want to share with you are things like that. So we do certification. We have accreditation requirements at CCI. And anytime a CCI speaker gives a presentation, we have to show you these slides. And this is an accreditation requirement that we give you this statement. There's no special advantage to listening to Jim speak. And I can't tell you that you're going to score better on the exam or your research is going to go better if you listen to this presentation. That's the gist of it. But we do have to show you this slide each time we present. So let's get on to our objectives. I am not going to read these to you. I'm going to talk about how we do education in healthcare. I'm going to tell you a number of factors that affect how we do healthcare and education, how we bring people into the profession, how we keep them current. And I'm going to try to stay agnostic and not dwell just on nursing, because I've worked extensively with central processing in my career. I used to supervise central processing in some of the hospitals where I worked. So I'm going to try to cover a variety of disciplines, not just nursing. I'm going to talk to you how regulatory and licensing bodies figure into this equation, and education and training of healthcare workers. And then finally, because this is a big part of my background, how credentialing organizations fit in and what they can do here too. So let's go to our first poll question. Lindsay's in charge of the technology. You do need to scroll down on your slides so you can see the submit button. So that I know my audience, take a second and check the one that applies. And if you do check other, write in the box what other is. In theory, we could have surgeons, anesthesia providers here, but I'm going to assume we have a big mix. And central processing and nursing is probably a fair amount of that mix, but also supply chain management, et cetera. So Lindsay, I'm going to go on to the poll results then to the next slide. Excellent. All right. So a diverse audience, and even back when I did my training in diploma school, and this is quite a few years back, Lindsay actually gave me some credit. I've been doing this since the early to mid 80s. I've always enjoyed working in central processing. And so I've always had a good bond there, and I'm so glad to see that we have central processing and nursing at this event. So let's get into the materials. First, let's talk about what we're doing right now in the current state of workplace training. How do we do things right now? And Lindsay, any feedback that you have? Audio, video, all good? Keep going.
All good, Jim. Sounds great.
All right. Okay. So some historical context. In the United States, the way we set things up is the employer and the individual take a considerable amount of responsibility for competency, education, and training. We don't centralize this as much as some other industrialized countries do. In nursing practice, in some countries, there's more national level organization and control over nursing practice. Here, especially for the workplace training, what brings you into a profession for perioperative nursing, central processing, anesthesia techs, has a lot to do with what your employer sets up, or the health system, the individual hospital, the surgery center. They have a big influence here. We have always used in the operating room precepted learning experiences, especially for nursing. It takes a long time to get a perioperative nurse ready to practice independently. Not unusual, 6, 8, 10 months. And we use preceptors a lot. But the other thing that we do in American healthcare is we use a lot of continuing education. And we make a lot of assumptions about continuing education. Part of what has to change, if we're going to do this better, is we have to re-examine continuing education, how we do it, how we can improve it, and how we can make it work better. And it may require a little bit less emphasis on continuing education and looking at other methods, because right now, for licensure, for certification, and for your ongoing competency and how you stay current in the profession, we use a lot of CE, and a lot of it is a classroom experience. You attend an event, you sit in a presentation, you fill out an eval, and then you get a certificate that says you've earned 1 CE. We're going to do that for this presentation. But what I'm saying is there are other things that we can do, and we have to examine the link between CE and competency. So I'm going to speak a fair amount on how much emphasis we have for CE. It's very familiar, it's convenient, it's easy to track, but I would maintain that we need to do more than just use CE. All right, so here we go. We continue to use some long-held assumptions about education. Some of the methods we've been using, we have been doing for decades. And so we assume that the current methods, that we set up some sort of education training program, we bring people into our professions, we do a lot of the training right in the workplace, and that all of these are adequate and they work well. We also assume that what we're doing right now, occasional updates, going to trade shows, etc., that is a good way to get evidence-based practice, new evidence and new techniques into the workplace and make sure that people use them consistently and people stay up to date. We also make a gigantic assumption, and I'm going to speak to nursing here, that licensure and certification processes actually maintain competency. And I'm going to give you a definition of competency, which kind of feeds our whole perspective here. But we make an assumption in American healthcare that if you hold a current license, that you possess competency in nursing. You pass the NCLEX exam, and for me, that was 30 some years ago. And you are assumed to possess competency, and unless you fail badly and have some egregious error, we assume that you still possess competency, and we don't track everything that you do since you entered the profession. Nobody really has charge of that, and that's part of the issue on why we have to re-examine education. And that somehow the individual nurse, in what they do at the workplace and what the employer helps them to do, gives them resources, that will help you to maintain competency. So I'm gonna go ahead one here, Lindsay. We have one slide out of order, so I'm gonna work ahead here. Let's talk about the concept of competency. So what exactly is competency, and why is it so important in the health professions? So certification bodies like CCI, we look at competency a little differently. We define competency as the actual performance on the job. And so you're going to hear a lot of terms slung around: competence, competencies, plural, meaning skills you have to check off; competence, the potential ability to perform. But what I would like to talk about is competency. So competency is the actual performance on the job. It's more difficult to measure, and it's a complex concept. So for CCI and other credentialing agencies, and increasingly with the licensure boards, they're setting higher expectations for competency and making it part of accreditation processes and licensure requirements. So we consider competency, we look at it we call it the KSA framework: knowledge, skills, and attitude or aptitude. Knowledge is the cognitive domain, what you know. Skills is the ability to do, the physical domain. And then aptitude is personal characteristics or traits. So let's talk a little bit more about each one, and I'll catch up to the slides here. So knowledge is your understanding of concepts, more theoretical classroom sort of stuff, and not always the practical hands-on sort of thing. And it's entirely possible to possess knowledge that you can pass the test, but you never actually applied the knowledge. So skills, on the other hand, have always been important in the operating room. Especially important with surgical technologists, with central processing professionals, that you can actually do the hands-on skills. You can operate the decon machinery, you can assemble instruments, those sorts of things, hands-on skills in training to get you there. It's a practical application of what you may have learned in the classroom, and is developed through repeated experience. So let's talk about some factors that affect healthcare education. So one thing out of sequence. The last part of that three-part thing is abilities. So these are traits, talents that a person brings to the task or situation. One of those is resilience. In the operating room, resilience is a key factor. the one thing when we talk about competency and learning, we, on the three parts of this, we're very good at dealing with knowledge and skill. But the one thing historically we've not addressed are things like soft skills, and resilience is one of those. And what we found out is we can assess these, we can help you to develop these. And I love Lindsay's analogy when she says resilience is like a muscle that you can develop. We know that. It's just that we've not been good about doing that in things like licensure and certification processes. So on this thing about knowledge, skills, and attitudes, all the components that go into competency, licensure bodies, et cetera, there's an increasing emphasis on these, but the difficulty is we haven't set up a system, the employer certification bodies, et cetera, we haven't set up a good system to help you to assess your competency and then develop these components. There's a gap here. And the other thing is consumer expectations are high as far as regarding our competency. Consumers pay an increasing amount of money for their health care. We're part of a litigious society, and nurses, consumers have high expectations for nurses for their competency. So the system is changing, and licensure and regulatory bodies, we have to adjust to that. So the issue for the employer who has a big stake here, we tend to focus on the minimum requirements. You know, is certain training done? Is it documented? Do we have it in our record? Because we have to meet accreditation requirements. So that's part of the problem. We put more emphasis on it, but we don't have a system set up well to make sure that you maintain your competency. And over the course of a career, can you continue to perform safely and consistently over the span of a career? So I already mentioned some factors that affect healthcare education. Let's talk about some other factors. I spoke to this earlier. Our regulatory licensure systems, they're not set up well to support lifelong learning. We made an assumption as long as you engage in CE and document a certain amount, that you're going to maintain competency. What is evolving here is that we have to change that view, and we may have to take a broader view. So things that affect our competency, your skill and your knowledge, there are two big threats, and these come to us from the credentialing, certification community: obsolescence and decay. So what we know, we have some knowledge about how we learn and acquire skill in the healthcare professions, and really how this happens in a lot of different professions. People have studied this. Where we lag in the United States is integrating best practices and how to maintain competency over the span of a career, and what is the most effective lifelong learning. And back to the resilience thing, that we don't incorporate some of the things like resilience or adaptability. We don't integrate those well into what we're doing now. We feel that licensure, regulatory bodies, certification agencies, they're all stakeholders and they can be part of the solution, but right now it's not well integrated. So obsolescence, that's when an individual lacks new knowledge or skills. And to be clear here, very few people ever become totally obsolete in the workplace. However, if you don't engage in lifelong learning and continuous professional development, you will become progressively more obsolete, and you're not operating at your full capacity. This is really a failure on the part of the knowledge worker, like central processing professionals and all the knowledge you have to do that job well. We don't stay current and put in the active work. So you have to actively work to do this well and to stave off obsolescence. There's also decay. And let's use the example of Jim and 30 some years ago. I attended a great nursing school, Toledo Hospital School of Nursing. It was a diploma school. They taught me a lot of things on how to care for patients on a ward. I don't I don't touch patients anymore. I don't do surgery. I do administrative work. So that knowledge of how to do that, how to start IVs, give injections, all of that is decayed. If I wanted to do that again, it's not in the memory bank back here. I would have to relearn it. So that's an example of decay. What we learn only has so much staying power, and it begins to decay over time. The rate and the magnitude of change in the operating room, in doing surgery and working in central processing, being a surgical technologist, being a surgeon, for gosh sakes, that pace of change is not slowing down. I don't see that happening in my lifetime. So for us, we have to acknowledge the limitations of our knowledge, the fact that obsolescence and decay can happen, and devote the work to stay current. So we also have to account for how evidence changes. And so groups like the Institute of Medicine have spoken to this about healthcare professions, and they're one of the driving forces saying that we have to do more than just CE. And we have codes of ethics in some healthcare professions. I know in nursing, we have the ANA Code of Ethics, and in there, it is our ethical responsibility as a profession to stay current so we can deliver the best quality care. And then also, I use the term continuing professional development and lifelong learning interchangeably. But continuous professional development means reviewing your practice, what you're doing, identifying your learning needs, plan and participate in relevant learning activities, and then do reflection. Reflect on how well all of that's working and continue to improve over the span of a career. Let's talk about resilience. And when Grace asked me, Grace from Census said, make sure that you touch on resilience. There's some pretty exciting things going on in nursing certification, but particularly at CCI. So what we have found out are these things that we call, collectively, we call them soft skills. So you have knowledge, and that's cognitive domain, what you know, but there's also non-cognitive skills. And those are things like resilience, adaptability, flexibility, the ability to think well on your feet. These sorts of things can be measured, and we can figure out for a given profession, what are the things that you need? One of the things that we found out in perioperative nursing, in terms of soft skills, what do you need? Resilience. And now we can measure that. In January of 2021, CCI will have a new testing partner, and they're called PSI. If you have a web-enabled device, you can look them up. Just put in PSI and certification. PSI also does assessments for things, other skills, traits, personality traits. And so they can actually measure resilience, and they can give you tools to help you develop a higher degree or higher amount of resilience. So what PSI tells us on these assessments, most, if not all jobs, have some degree of pressure. Resilience is a key factor in determining how you react or adapt to pressure. While the sources, those challenges, and how they present to you may differ, and it may be different for central processing versus being a surgeon, but all of us get exposed to stressors. How you interpret and respond is vital to ensure that you can function. It's a component of competency. So we can measure this, we can help you to improve it. That's all part of what certification bodies could do. But let's acknowledge being part of surgery, whether you're processing the instruments, you're handing the instruments, you're storing the instruments, it's high stress and it's high stakes. So stress can take many forms, but resilience helps you to deal with stress in a positive way. For an employer, knowing the amount of resilience your employees have and helping them to develop a higher degree of that is a very helpful thing for the workplace and in the performance of your employees. So helping them to ensure that they have resilience and they can build it up is helpful, and it gets you better results. Talk about regulatory bodies and education and training of healthcare workers. This is my slide to remind me. I will speak only to nursing here. The United States is not the world leader in how we do education and training of nurses. I've been studying this for a long time. I did my doctoral work on this. I will tell you there are things we learn from other countries. 3 of the countries that do this particularly well: Great Britain, Australia, and Canada. In these countries, they will ask you to do more to keep your license than we ask nurses to do, certainly for licensure, but even for certification. Their requirements exceed mine, and I have some of the highest standards for recertification in earning our certifications. These licensure bodies ask you to do more in these countries than I ask of nurses to hold certification. So there are things we could learn here. We lag other countries regarding maintenance of competency and specifically assessing competency. What we do know is the maintenance of competency in developing things like resiliency and staving off obsolescence and decay requires active work. To stay up to date, maintaining competency, staying up to date is one contributing factor. There's an interaction between resiliency and maintaining your competency. And licensing boards, regulatory bodies could take a larger role, but this is a very complex thing. So let's talk a little bit more about that. You probably listened to this thus far and you're thinking, man, Jim is wearing me out here. This is a really tough scenario. What can we do? This seems really daunting. How do we go forward? So let's talk about credentialing bodies and what they can do, because this is where Jim comes in and where groups like ISHM, the Certification Board for Sterile Processing, this is what we could do. And we made some tentative steps about how we can help on your professional development. So we need to acknowledge, and CCI believes this, that knowledge and skills are essential components of competency, and things like personality traits also contribute to your competency. We believe that the twin threats of obsolescence and decay, we think where they're real and we need to address them. And we think the process of staying current with knowledge and skills could and should be easier for healthcare professionals. And we're trying to do our part for nurses, but we think that certification bodies are part of the solution. We also, CCI is established, we have good resources, we're more nimble, and we're willing to act, and we're willing to take some risk, and we're also willing to partner with groups like Census and Beyond Clean to address these issues. But this is all a balancing act. For CCI and other certification bodies, we have to balance ease of use, access for our certificates, cost, and the value to the profession. I could devise a great program that I think really addresses competency. It's rigorous. The certification and accreditation bodies would love it. And if the nurses hate it and say it's cumbersome and they don't like it, it's not going to be adapted. So all of these things have to be balanced, and we have to consider the weight of the evidence about how effective all these things are. So here's what we do at CCI. If you are certified with us, this is 41,000 nurses around the world, you have your own learning portal. And other groups do this. Isham has some great education, and so does Beyond Clean. So groups that are involved here, but all are starting to do this sort of thing. For CCI, 24/7, 365, the middle of the night, you could be sitting on a couch in your pajamas, and if you want to develop your competency and do online learning, you can. You sign in to your learning management system, your LMS, and we have a wide diversity of activities in there, and you can do those at any time that you want. You just have to stay certified with us, pay your fees, renew your certification, access this learning management system. You could do everything that you need to stay certified completely within this system. And the best part, there's no charge. If you're certified with us, you don't have to buy booklets. You don't have to go off to a course. You could just stay at home in these extraordinary times and do it from your couch. So we also think that we need to study how we learn and acquire skill. We can do much more. We also need to study all these assumptions that we have, that our current methods of bringing people into the professions, that all of this works. So we're doing that. I'm the CEO of the CCI Research Foundation. Last year, we put out grants for $88,000 to study things like this. How do people learn in the operating room? How do they develop competency? This year, we just finished our funding decisions. We granted $200,000 to study things like, why do people decide to get certified? If it's completely voluntary, and for nursing, it's mostly voluntary, why do people decide to get certified? Or why do they choose not to certify? We're studying things like that and challenging our assumptions that certification works well, it helps with your competency, you get better outcomes, you have lower infection rates. These are things we study, and we do fund multidisciplinary teams. We would love to see proposals from teams that involve central processing and studying things like, how do we do this more efficiently? How do we improve communication with the operating room? We would love to see multidisciplinary teams that include other professions and nursing, and we're just getting started. My prediction for next year, we will fund $200,000 again next year. But there's other issues regarding resiliency, and I'd like to touch on those briefly. We think we can do a lot better job of recruiting, selecting, and training in the healthcare professions, but a special passion for Jim is, how do we do this in perioperative nursing? We think we can do it better. So for a lot of the healthcare professions, there is not a standardized path. The employer sets up a lot of the requirements for education and training. We don't always incorporate the latest research-based evidence, and quite frankly, we don't have a lot of evidence about what are the best and most effective methods. We don't agree on the educational requirements, and so the employer by default, because they have to meet Joint Commission requirements or AAAHC or whatever the accrediting body is, they take this by default. So for perioperative nursing, even though our orientation is the longest in all of nursing, and that we were the first recognized specialty in all of nursing, there are very few schools that you can go to become a perioperative nurse. A handful in the entire country, and we don't have a standardized core curriculum. So I'm going to talk about what we could do about that, but that brings us to our next slide, our second and last slide. Tell me what you know about the Department of Labor and their apprenticeship program. And remember, you have to scroll down a bit to get to the submit button. So I'm going to take a sip of coffee and let the results come in, and then we'll go to the next slide. All right. Well, good. Okay, so let's talk about apprenticeships and how they can work in healthcare. So we've studied this, and we've actually used some of this terminology in nursing. So there's a nursing theorist, her name's Patricia Benner. You may have heard of something called the novice to expert framework. That was her work. She believes that any healthcare, any profession, if you want to develop competency, you have to do three things. You have to master the intellectual training, the knowledge base. You have to complete a skills-based apprenticeship or training. For nursing, how do you insert an IV? Those sorts of things. And then finally, you have to integrate and socialize and learn the social mores of your profession and how it works. If you'll notice, there's a lot of overlap between that and competency in the KSA framework. So, one radical idea, why don't we embrace the apprenticeship model and elevate the way we bring people into our professions and how we help them in lifelong learning. And we made some tentative starts here for things like residency programs and transition to practice, but I think we can do much more. And we have some of the pieces to the puzzle. Some of us are doing parts here, certification organizations, licensing bodies, and there are apprenticeships, but right now they're not widely used in healthcare. But it's going to take a change in personal perspective, and the employers who have a big stake are going to have to engage. So we've attempted to address the issue. This is a picture of Patricia Benner. She studied a lot on how nurses acquire skill, and she wrote a book called Educating Nurses, A Call for Radical Transformation, and used a lot of this terminology. And what she said is, back to these three things, she used the term apprenticeship, but sadly, what she put forth in that book didn't gain a lot of traction because nurses don't like the term apprenticeship, because nurses think of this as something that's done by electricians or carpenters, not knowledge workers like nurses. So what is an apprenticeship? The Department of Labor has a program. Put your politics aside, but this is a very recent initiative by the Trump administration to develop apprenticeship models for more professions, not just the building trades, but other professions, and it could be used in healthcare. So what are the components? You hire someone into your facility and pay them while they learn. You do on-the-job learning. You do combine that with classroom and laboratory experience, and you use preceptors and mentors as part of the experience. And this all becomes standardized. I will tell you right now, this is what we do in nursing central processing right now. This is what we do, except for one part, the fifth part, the actual credential. So we need to have a standardized credential. That's the component that's missing. So in nursing, we do this. We hire people into the operating room. Many places train, the employer trains the nurse. We provide the education, whatever form that takes. And the one thing we don't do, we don't have a credential at the end that's standardized that everyone recognizes. So these are examples of where apprenticeships work right now. So let's use the example. My father was a skilled tradesman. It was called millwright welder. When he finished his training, which was done by his employer, it was almost exclusively on the job. He received a journeyman's card as a millwright. And there's journeyman cards for electricians, etc., but that's the recognized credential. In nursing, perioperative nursing is not a protected title, and we don't have a recognized credential that says this is the training that I've had and I'm a perioperative nurse. CCI wants to use some of what apprenticeship models do to address this thing about how we bring people into the profession. And I told you we were coming back to this. CPNF is how we plan to address this, and it's not just another credential. Here's the core features. What we propose is to standardize how nurses come into the profession, and then we're going to address that fifth and final part. We're going to provide a credential, a standardized documentation about what nurses learn when they come into the operating room. We think certification bodies can do this, help to establish the knowledge that people need to do this, to include things like resilience and soft skills, help to measure it, and then document this and establish this for healthcare professions. And how we document it is going to change. You can look up Credly on your web-enabled device. They're a partner with CCI and PSI, our testing body. What we propose is once we do all of this, there will be an electronic file behind that credential. It's controlled by CCI, but all of what you learned, the summary of all of that you took a soft skills assessment, you did a competency assessment, all the components for CPNF, you passed the knowledge-based test, that we addressed all the parts of knowledge, skills, and attitude. All of those will be documented, and if you choose to share that with a digital badge, which is what Credly does, you can share that. On your LinkedIn profile on Facebook, you can share it. And credentialing bodies can do this. And you can document your ongoing learning over the course of your career, the additional credentials that you earned. All of that can be documented and kept on a digital badge. And that's what we propose for documenting ongoing learning. So, if you have a web-enabled device, you can do a search right now. You're probably wondering, why did this guy just put this picture up here? You can Google BB, that's Bravo, Bravo 36. There's a connection here. We're near Veterans Day. I'm a Navy veteran. There used to be a saying, and if anybody figures this out, what BB 36 stands for, there's a connection to this picture. Type it in the chat box. And Lindsay, let me know if anybody does come up with this. There used to be a saying for the more mature members of the workforce, when you were faced with a particularly difficult task, you would say that's like trying to turn a battleship. This is a picture of a battleship, one in particular. I used to live in a state where this battleship is still afloat. It's the only battleship that served in World War I and World War II, and it's maintained. It's in the state of Texas. So right now it's in dry dock. This is the USS Texas. So when I say changing how we learn and all these education processes, that it's like trying to turn a battleship, yes, it's going to be hard, but we think it's that. So Lindsay, Don W says that's the hull number for the USS Texas. That's correct. That's the numbering system for battleships. BB-36 is the USS Texas, and it's close to Houston, Texas. It's a big source of pride for the state of Texas that a battleship built in, I think, 1911, they still maintain it. So Well done, Don. Thank you. This, I'm just about done here, and I've got to enlarge this slide on my side. This is a big challenge for the healthcare professions. I will tell you that I also love theater, and I particularly love Shakespeare. I love this quote. This one I'm going to read for you, but I think it's applicable when we have to think about making these big changes. There's a tide in the affairs of men, which, taken at the flood, leads on to fortune. Amid all the voyages of their life is bound in shallows and in miseries. On such a full sea are we now afloat. We must take the current when it serves or lose our ventures. That's from Julius Caesar. We think for the healthcare professions, we need to re-examine how we do education and training, how we address lifelong learning, and how we also think about things like resiliency, because that's part of your competency. It all is tied together. We think there's a big opportunity. There's a big challenge here too. But CCI thinks that this is a good time to set sail and see where our ventures take us. And that's our outlook. We're very proud to say that we have Census and Beyond Clean as our partners. They think like we do that this is important. They each provide educational materials which we make available to our nurses, and they're part of this effort too. So thank you for Census for letting me share my thoughts. That's it. I'll take any questions if we have them. And Lindsay and Grace, I promise you I'd finish on time.
You did. That is true. We do have some time for questions, and we have gotten a couple of great questions that have come through. And just a quick note, thanks to everyone who's been engaging with the group chat feature. Jim, I'm going to get right into these questions. The first one says, great theme to discuss with all of our hospital leaders. My question is, why are our administrators not paying attention to this theme?
You know, let's acknowledge that administrators right now are in incredibly challenging times. They are right now trying to deal with a crisis, and let's acknowledge too that the immediate crisis of the pandemic isn't going away tomorrow. We're right in the middle of it, and there are some facilities struggling to survive. I think we could raise awareness levels. And the other thing is, I think we could help administrators to establish the value proposition for things like certification. ISHM, I will tell you, I've worked with ISHM for a long time. They are superb. We could establish that being certified and engaging in lifelong learning actually provides value to the organization. So I think we can do our part. We can establish the value proposition. We can keep this fresh for administration. I think we can help them and say, look, if you will help invest in our workforce and our lifelong learning, we can get you better results. We can be more efficient. We can get better patient outcomes. We can lower your costs. And let's show you how we can help do that. I don't think this is on the front burner right now for administrators. I think we can help them get there, and we can do it in a collegial fashion. Ultimately, it'll be good for our workforce, and it'll be better for our patients. And really, that's why we do this, is to deliver safe patient care. And so right now, it's probably not front burner, but we could help bring it to the fore, and we can do our part to help administrators. But I would admit right now, because I've been an administrator at a hospital, this is not front and center for all administrators. Next question.
Okay. Next question is, looking at your site, it looks like it's more geared toward nurses that hold current licensure. How does the certifying body help CPD professionals further their credentials? I knew you'd like this one.
Lindsay, so a perfect lead-in. You're correct. For 40 some years, CCI has been focused on nurses. We are changing. In the year 2021, these are in development right now. We are developing micro-credentials, which will be documented with those digital badges that I showed you. And Lindsay, I'm going to take a step back. We are going to put together micro-credentials in conjunction with Beyond Clean that are available to all healthcare disciplines. So central processing, perioperative nursing, supply chain management, any group could come to our website and in 2021, take micro-credentials, earn a digital badge, and eventually earn a certificate of mastery, and it's a multidisciplinary credential. And we are going to do that in conjunction with Beyond Clean. That's our first step. In the year 2022, we will begin developing a credential that can be earned not only by nurses, but also by central processing supply chain management professionals. It will be a multidisciplinary credential in surgical services leadership, and that too will be open to central processing professionals, and it won't be an RN only credential. We realize the value of interprofessional education. The Institute of Medicine tells us it's important. So we're engaging with groups like Census and Beyond Clean to do that. And in 2021, you're going to start to see that. When you go on our website in 2021, you will see things that are not just nursing, but also multidisciplinary. So we're making our first tentative steps. And Lindsay, I don't think that question was a plant or anything, but it sure was a perfect lead-in to talk about our partnership.
It certainly was. Yes, it was not a plant. So thank you. It was a perfect segue. You're right. Jim, this next question I think is I'm really interested to hear the answer of this one too. What makes countries like Australia the best in continuous professional development?
Let me cite a quick example. In Australia, Canada, England, they follow a similar system because they're all the former United Kingdom countries. There's a lot of commonalities. For a nurse, just like the United States, you have to pass a knowledge-based exam to become a nurse and become part of the registry or become licensed. In Australia, to keep your license, every 2 to 3 years, you have to document a continuous professional development plan and document your lifelong learning, what you're going to do in the next couple years to keep your license. And then they audit you and make sure that you do it. In Canada, they actually, for a very small percentage of their nurses, they go to your workplace and check your ID and your plan and look at your documentation to keep your license. To become a perioperative nurse in the highest level of the profession in Australia, you have to complete post-licensure education, which is equivalent to an associate degree in the United States in the field of perioperative nursing. Those are two examples. We don't have anything the equivalent of that in the United States. In these countries, they ask them to do more to keep their license than I require nurses to do to be certified. And those are just two examples. They place much more emphasis post-licensure. In the United States, we put a lot more emphasis on pre-licensure education and accrediting those programs, but much, much less after you earn your license. I hope that answers the question.
Wonderful. Many people have commented and written in, thank you for your service. There is one individual who says, you were my division officer in Naples. Um, so
Oh,
welcome, Amy, and thank you both for your service. um, one final question, Jim, as we wrap up, someone is asking, how do I best prepare for an examination administered by CCI? Can you give your best tip for anyone preparing for credentials through CCI?
yes. So I'm going to tell you that you now have my email. We're changing offices, but number one, you can send me an email and I'm going to send you resources. But here's my best tip. Before you spend one penny of your hard-earned wages, go to our website and look at all the free resources that are on that site. We have a study plan. We have free webinars. Go there first. Spend your money wisely, but first use all of the free resources first. Don't rush out, and do not, when people advertise on a website and say, we have the secret to passing CNOR, don't believe it. Let the buyer beware, make informed decisions, and go to the website first, and then call a credentialing specialist at CCI and ask them any question you want. We have people that are trained to help you earn a credential. And if they can't answer your questions, they'll get you to a nurse. Use all of our resources, the free stuff first, think it all through, and then put together a good study plan and give yourself 3 months to study.
Wonderful. Jim, thank you so much for this presentation. Everyone who's tuned in, if you're still looking for additional CE credits to finish up your learning this year, certainly tune in to the remainder of the Census True Grit webinars, and you can now earn free CE credits through the True Grit app, the Census True Grit app, which there's a link to in the resources tool on the upper right-hand side of your page. Last month, Census shared 2 articles and a video related to the theme of leadership. These programs are worth 1 hour and 15 minutes of ISHM or CBSPD continuing education credit. You can, again, like I mentioned, download the Census True Grit app directly from your screen. In about an hour, you will receive an email that will have a link to this session on demand, along with a link to access the session survey to download your CE certificate. Shortcut for you, if you click on the little icon that says CE along the bottom of your screen, you can also access that same thing. You can watch this session again, you can reference it, you can share it with your colleagues, and in whatever way you engage with this content in the future, we hope that you take the idea and the concept of lifelong learning and also that of resilience to heart. On behalf of Beyond Clean and in partnership with Census Technologies and CCI, we thank you for joining us today. And as always, we encourage you to keep fighting dirty. Have a beautiful day, everyone.